What's better than Monday? A dentist appointment. Lori's going to make it fun for us, so right, Lori?
Say hi, Lori.
Oh, yes, we're going to get educated this morning, Bob and Annette. We're going to talk about dental implants. And we have here Dr. Brown from Alton Dental in Burlington who's going to tell us more. So what exactly is a dental implant?
Well, a dental implant is an artificial root that is actually implanted into the jaw. They're very similar to the structure of a tooth. In this case, you have a tooth which has a root, the pulp, and the crown on top. And the implant is a root, scaffolding, and a crown on top. So they're very similar in structure.
How long does it stay? If you're going to get a dental implant, does it have a short lifespan?
They're not, it's not replaced like a hip or a knee, although it's made of the same base material. They're designed to last a lifetime, basically. And their success rate is very high.
Is it for everyone?
Most people can have dental implants, unless they have like their uncontrolled diabetes, or if they have something going on with their immune system. If they're generally healthy or controlled, they can have implants. It's not a problem.
What happens if you, what's the difference between having an implant versus a bridge, let's say, for example?
A bridge this is an example of a bridge here where there's a tooth missing, and the teeth on either side are kind of trimmed down so that you can put a crown structure on there, and you have a false tooth supported by the crowns on either side. The advantage to the implant is that it has its own root structure, so it's very strong, and you don't have to touch the teeth on either side. So the advantage also with an implant is this process called osseointegration. They're made out of titanium, which has the unique property of allowing the bone to grow right to the titanium.
So when you put the titanium on, the bone grows with it. Is that what you're saying?
Goes right to it and joins to it. It's the same with hips and knees. They use titanium as well for the same reason. So.
We're going to explain more right here at Alton Dental. Please stay with us. We'll be back. We're talking about bone loss and the effects if you don't work on it right away. We're going to continue here with Dr. Brown at Alton Dental right here in Burlington. So we're going to look at the different stages of bone loss right here as an example as well. Can you tell us more of what happens to our teeth?
Well, physically, what happens is when we lose teeth, we get bone loss. And bone loss it's progressive and it's irreversible. And it can be very rapid as well. And of course, missing teeth causes reduced chewing ability and function. Dentures reduce only 20 to 50% of natural tooth function. But this is what happens basically when teeth are lost. This is a progression of how your jaw reacts over a period of time. You can see that progressively it gets smaller and smaller, and the same on the top. Coming back to implants, the main advantage of implants is that they arrest that bone loss. So they
stop it?
They stop it. So the sooner after the tooth is extracted that you can actually get the implant in there, the sooner that bone loss will be arrested. And so that's one of the main advantages of the implant. And nothing else will do that. A denture doesn't do that.
A bridge doesn't do that.
A bridge doesn't do that. Only implants or a natural tooth will stop that bone loss. But, you know, really missing teeth limit what we eat on a daily basis. It affects our social and emotional status because we eat, we talk, we sing, laugh, we're intimate with our mouth and our teeth. So actually missing those teeth can have a fairly drastic effect.
So what you're saying that it will affect you not only physically but emotionally as well?
Absolutely, yeah.
Okay, we're going to continue right here with Dr. Brown at Alton Dental as we go to you, Jackie.
Thank you, Laura. Okay, let's talk about the roads this morning, see how your drive is.
And we're talking about dental implants right here with Dr. Brown. He's going to tell us about his patient, Ken, and actually he had one just this Friday. We're going to also speak to him. Please stay with us. It's all about being educated about dental implants. We'll be right back.
To check on your forecast, it's all about teeth this morning. Here's Lori.
That's right. We are here at Alton Dental in Burlington, and we're going to continue to talk about dental implants. Here, we're going to discuss the difference between a bridge versus a dental implant. Ken just got his done on Friday. He's still alive. That's good. But we're going to continue here. What's the difference between the... Price is a difference, though, as well, when it comes to...
For a single tooth, not much of a difference.
Really?
So you have quite a few options to replace a single tooth. And the reason implants are more or less the standard of care is because it stops the bone loss. So let's look at the two most common options to replace a missing tooth. This is a bridge. And so what a bridge is, there's a missing tooth there. The teeth on either side are kind of shaped to accept a crown. So there's a three-piece crown. There's a false tooth and two crowns that goes on as one unit. It works very well. It doesn't stop bone loss, and you have to cut down the adjacent healthy teeth. The advantage of the implant is it does stop bone loss. You don't have to touch the adjacent teeth. It's stronger. The cost is not much different between a fixed bridge and a single implant. You're looking at somewhere around $3,500 in either case. Of course, the other option for a missing tooth would be this, what's called a thumb partial, or a flipper, which has a single tooth on a plate. And of course, it has its own problems. It's more cosmetic. You can't chew on it. And
So if you do decide to get an implant, does it hurt? How long does it take? Are there certain steps that you have to take in order to... You know what? We're going to discuss this in the next segment. We're also going to speak to Ken and also ask him what his experience was. Coming up, we are here at Alton Dental in Burlington. We'll be right back.
Buildings.
And Bob and Annette, we're going to continue right here, Alton Dental in Burlington. Next up, we're going to talk not only to Dr. Brown, but also to Ken about his experience with dental implants. Please stay with us. We'll be right back.
All right, that's a check in your forecast. Back to Alton Dental. That's where Lori is this morning. Lori?
And we're talking about dental implants, and we're actually going to speak to a patient as well and talk about his experience. So Ken, what we see over there is his x-ray. Yes, Doctor?
correct. This is the implant I just placed on Friday.
How long does it take usually to get an implant ready?
You mean to put...
To put it in and to actually have an implant?
well, the implant itself, under an hour to put that in. But then the healing process takes usually 3 months before you can put the tooth structure on there. It used to be that it used to be 6 months or more, but with the improvement in designs, etc., it's down to about 3 months now.
Do you have to sedate your patients?
Don't have to. I didn't have to sedate Ken, but he's an airline pilot, so he's brave. You know?
Thank goodness. Yeah. So Ken, I do have to ask you a few questions. Did it hurt?
No, it didn't hurt. Not more than any drilling for a filling.
How was it compared to other stuff that you have had done in the past? Was it long? Was it tedious?
No, just as Dr. Brown said, just a normal hour in the chair and the drilling and put the implant in. That's it.
Is there any downtime when it comes to doing something like this?
No, until the freezing came out. I was at home, the freezing came out. I was eating supper that evening, doing things normally on Saturday. So no, there's no downtime to it.
And how is it different from what you had before compared to having a dental implant now?
Before, you realized, you probably didn't realize that you didn't have the tooth and you chewed on your gum. As soon as you get the implant in, you realize what you've been missing for so many years. It's back to normal again. You've got your teeth.
And that's usually the reaction that you usually get when you have someone have a dental implant.
Absolutely. Most people are glad they had the implant done and wish they'd had it done sooner.
Yeah, exactly.
So we're going to continue more with some more information about dental implants and who best suits dental implants as we go back to you, Bob and Annette.
All right, thanks, Lori.
Okay.
Well, this weekend, the BBC.
All right, that's your forecast check. Alton Dental is the place, and let's get back to Lori. Lori?
We're going to continue and talk about dental implants. Now, dental implants are not just for those who are missing a tooth. It could be several teeth or all. So first of all, we're going to look at Ken's x-ray. Dr. Brown is going to show us an example how you did it not just for one tooth, but several.
Yes, that's correct. So I did this several years ago for Ken. There's 2 implants there which are supporting a 3-tooth bridge, similar to what I showed before. Now, the other option, I could have put 3 implants in there and put teeth on each one of those. But this is a more economical option. And so Ken's been dealing with that for 4 or 5 years now and been doing fine with it.
So because it's more than one, does that mean you said the wait time was about 3 months?
Same.
Is it 3 months each or 3 months
No,
altogether?
they were done together. So yeah, it's 3 months altogether, and then you can restore it with the bridge.
You can also use it for, what do you have there in your hand?
This is a full denture, and this is one of the most popular uses of implants. In this case, there are 4 implants that are used in there to support a full denture. And these things tend to slop around a lot without any implant support. But the way that these are set up, it just snaps on there, and that's really solid.
So you don't have to take it out?
You do take it out, but,
yes.
But it's tight. You know,
Okay.
It doesn't flop around. It goes in there and it snaps in quite solidly.
And
So-
there are studies done
Yeah.
at McGill
Let me just
University.
read this. I'll just read this conclusion. This was McGill University had a international symposium a few years back. But there's a substantial body of evidence is now available demonstrating that patient satisfaction, quality of life with implant-supported overdentures is significantly greater than for conventional dentures. Much of this data comes from randomized controlled trials. So, I mean, there's a lot of evidence. People are more happy that they made the investment in the implants. They chew better, but more importantly, their health is better.
And we want to tell the viewers out there, if they have any questions on a monthly basis for free, you have seminars at Alton Dental.
Yes, I do.
So you can help people who have any questions or concerns or are considering dental implants. We're going to continue right here in Burlington. Please stay with us. We'll be right back.
I started thinking about the rest of my life. I found myself just looking out for trouble and strife. Someone with
This morning we're talking about dental implants and how it is right here at Alton Dental with Dr. Brown, and we were looking at Judy's case. So dental implants are not only for losing a tooth, it could be a tooth, several teeth, or all, and there's also different cases as well. Mm-hmm. So let's talk about Judy's.
Okay, well, Judy's were the first implants I ever did. She was my guinea pig, so to speak.
And she's still alive.
Under the very excellent direction of Dr. Milan Sombrak in Collingwood, I placed these 3 implants 17 years ago for Judy.
17 years ago.
And they're still there. Since then, I've placed a number of other implants. As Judy has a hereditary condition which causes her to lose her teeth prematurely. And so she couldn't get anybody else to place the implants because of that, so I wound up doing it. The last ones I did for her were here, and we didn't think there was going to be enough bone to put these implants in because the nerve runs very close there. But there's a Nowadays, you can have a three-dimensional X-ray taken, and the radiologist who looks at that will actually virtually place those implants in the jaw, and then he can actually print a surgical guide out of plastic based on the X-rays and some plaster models, and he'll send this in. This fits over the teeth. The angles are right, the depth is right, so you just put the implants in according to
That's
this
fascinating.
guide. And we were able to place these 3 implants using this technology.
So no matter how much it's deteriorated, there's still a possibility.
There's still a possibility. Now, there wasn't a possibility on this side, unfortunately, but this side, which is the one that she wanted to restore, we were able to put these 3 implants in. These are ready now to be completed and have the teeth put on them.
If anyone has any questions, Dr. Brown, he does have a seminar on a monthly basis. It's about an hour long and it's for free. And if you have any questions, you can come to the seminar and you can also ask him tons of questions. We are here at Alton Dental in Burlington with Dr. Brown as we go to you, Brian.
All right, thank you very much, Lori. Let's go right to our pool shop backyard forecast for today, the 1st of